Picture this. You're standing in the supplement aisle of your local pharmacy. The shelves stretch from floor to ceiling, packed with hundreds of bottles, each one shouting at you with bold lettering and bright colors. Boost your immunity, strengthen your bones, restore your energy. You reach out, pick one up, read the label, set it down, pick up another. 10 minutes pass, maybe 15. You leave with 3 or 4 bottles tucked under your arm, hoping you've made the right call, telling yourself you're doing something good for your body. Most people in their 60s and beyond have been in that exact moment. And most of them walk out of that store with at least one bottle they absolutely should not be taking and leave behind at least one they genuinely need. My name is Dr. Marcus Calloway, and I have spent the better part of 3 decades focused specifically on the health of older adults. Not general medicine, not pediatrics, not emergency care, the biology of aging, the nutritional needs that shift dramatically as we move through our 60s, 70s, and beyond, and the ways that well-meaning supplementation can quietly work against the very goals we're trying to achieve. This is the conversation I have with patients every week. And today, I want to have it with you. We're going to go through 8 specific supplements. For that, most people over 60 should stop taking on their own initiative, and 4 that deserve a permanent place in the daily routine. The answers are not what most people expect. Some of what ends up on the avoid list will genuinely surprise you. Some of what ends up on the essential list has been quietly undervalued for years. And by the end of this, you'll have a clearer, more grounded picture of what your body actually needs right now in this chapter of life, not what the marketing on the label wants you to believe. Let's begin with the supplements that deserve a second look. And before we go any further, I want to be precise about something important. When I say you should avoid these, I'm not saying they're universally dangerous or that no one should ever take them. I am saying that taking them without specific medical guidance, without a blood test confirming a deficiency, without a physician's recommendation, is where the real risk lives. If your doctor has reviewed your labs, identified a genuine need, and recommended one of these, follow your doctor's advice. This conversation is about the dangers of casual, unsupervised supplementation. Those are 2 very different things. The first supplement on that list is one of the most commonly purchased in this age group, iron. And the reason people reach for it makes complete sense. Fatigue is one of the most common complaints among adults over 60. Iron is associated with energy, with healthy blood, with fighting tiredness. The connection feels logical. But for men over 60 and for women who have passed through menopause, the biological reality has shifted significantly. Here is what changes. Younger women lose iron regularly through menstruation, and their bodies are calibrated to absorb and use more of it as a result. Once that monthly loss stops, the body's demand for iron drops substantially. And iron has a particular characteristic that sets it apart from many other nutrients. It accumulates. The body has very limited mechanisms for eliminating excess iron, which means that what goes in largely stays in. Over years, excess iron builds up in tissues and organs, particularly the liver, the heart, and the pancreas. This accumulation, known medically as iron overload or hemochromatosis, can cause genuine organ damage over time. What makes this especially deceptive is what iron overload actually feels like in its early stages. Fatigue, joint discomfort, a general sense of physical heaviness. The very symptoms that lead someone to buy iron supplements in the first place. So the cycle becomes self-reinforcing. A person feels tired, takes iron thinking it will help, begins to accumulate excess iron, feels worse, and reaches for more. Unless a blood test has specifically confirmed iron deficiency anemia, iron supplements have no business being in the daily routine of most adults in this age group. Get your iron from food sources instead. Modest portions of lean red meat, legumes, dark leafy greens, and let your physician be the one to recommend supplementation if the labs actually call for it. The second supplement that deserves careful reconsideration is one that has enjoyed a long and largely positive reputation. Vitamin A. Specifically, high-dose vitamin A in its preformed state, the kind you find listed on labels as retinol palmitate or retinol acetate. For decades, vitamin A was celebrated for its role in vision, skin health, and immune function, all of which it genuinely supports at appropriate levels. The problem is that it is fat-soluble, meaning the body does not simply excrete what it does not immediately need. It stores the excess, primarily in the liver, and over time that storage can reach levels that cause real harm. Vitamin A toxicity from prolonged high-dose supplementation produces symptoms ranging from persistent headaches and dizziness to more serious liver complications. But the finding that has most reshaped how physicians think about this supplement in older adults involves bone density. Multiple large-scale studies over the past 2 decades have consistently shown that elevated intake of preformed vitamin A is associated with measurable reductions in bone density and a corresponding increase in the risk of hip fractures. Read that again. A supplement you may be taking for general health is linked to more fragile bones. For a population where a single hip fracture can be a life-altering event, that is not an acceptable trade-off. Here is the important distinction. This concern applies specifically to the synthetic preformed vitamin A found in supplements and many multivitamins. It does not apply to beta-carotene, the precursor form of vitamin A found naturally in orange and yellow vegetables, carrots, sweet potatoes, butternut squash, and dark leafy greens. When you consume beta-carotene from food, your body converts only as much as it currently needs into active vitamin A and leaves the rest unconverted. You cannot create toxicity through food sources. So enjoy those colorful vegetables freely and generously. Just examine any multivitamin or supplement bottle you currently own and take note of whether it contains retinol palmitate. If it does, and you have no specific medical reason for taking it, that is a conversation worth having with your doctor. Third on this list is a supplement that was genuinely considered a breakthrough when it first rose to widespread popularity. High-dose vitamin E. The antioxidant narrative around vitamin E made it enormously appealing for decades. It was going to protect the heart, slow cellular aging, reduce the risk of chronic disease. People were taking 800, 1,000 international units per day, convinced they were giving their bodies powerful protection. Then the long-term studies started producing results that nobody expected. Rigorous research, including a major analysis out of Johns Hopkins that pooled data from multiple large trials, found that high-dose vitamin E supplementation, defined as 400 international units per day or more, not only failed to deliver the promised cardiovascular benefits, but was associated with a modest but statistically meaningful increase in overall mortality. It also showed a connection to elevated risk of hemorrhagic stroke, the type caused by bleeding in the brain rather than blockage. Beyond those findings, high-dose vitamin E has a significant effect on the blood's clotting mechanisms. For older adults already taking blood-thinning medications, or for anyone facing a surgical procedure, that interaction can create serious complications. And here is the broader point. True vitamin E deficiency is genuinely rare in adults who eat a reasonably varied diet. The vitamin is abundant in nuts, seeds, olive oil, and various vegetables. The complex mixture of naturally occurring tocopherols and tocotrienols in food is biologically quite different from the isolated synthetic form found in high-dose capsules. There is no meaningful clinical benefit to supplementing in the absence of a confirmed deficiency, and the potential downsides are real. A small handful of almonds each day delivers meaningful vitamin E alongside a range of other nutrients your body genuinely uses. The fourth supplement that requires careful handling is one that sounds, on the surface, as though it should be entirely beneficial. Vitamin K. It is involved in blood clotting and in directing calcium toward bone tissue and away from arterial walls. Its functions sound precisely like what an older adult needs. In the right context, vitamin K is indeed essential. What lands it on this list has nothing to do with its biology in isolation. It has everything to do with its interaction with one of the most commonly prescribed classes of medication in this age group. Millions of older adults take anticoagulant medications to manage the risk of stroke and blood clots. Warfarin, one of the most widely used, operates specifically by limiting the activity of vitamin K in the clotting cascade. That mechanism is intentional and medically precise. When someone taking warfarin suddenly introduces a vitamin K supplement, they are directly interfering with how their medication works. The result could be a dramatic and dangerous shift in the blood's clotting behavior in either direction. A clot that forms where it should not, or bleeding that will not stop when it should. Even in the absence of anticoagulant medication, altering vitamin K intake unpredictably can disrupt clotting balance in ways that carry risk. The principle here is not that vitamin K is harmful. It is that any significant change in its intake needs to happen with full medical awareness, documented in your health record, discussed thoroughly with your physician and pharmacist, and monitored accordingly. This is not a supplement to add to your routine based on a label claim or a recommendation from a friend. Now we turn to the other side of this picture, because there are 4 nutrients that the body's changing biology in this chapter of life genuinely calls for. Nutrients where the science is not just adequate but substantial, where deficiency is common, where consequences are measurable, and where thoughtful supplementation makes a meaningful real-world difference. The first of these is vitamin B12. And to understand why it matters so much specifically to adults over 60, you need to understand a biological shift that happens gradually and quietly as the digestive system ages. The stomach lining progressively produces less hydrochloric acid as we get older. This is extremely common. And while reduced stomach acid might sound like merely a digestive inconvenience, it has a profound effect on one particular nutrient. B12 from food is chemically bound to protein. Stomach acid is what breaks that bond and liberates the B12 so it can be absorbed. When acid production declines, that release does not happen efficiently, and the B12 you consume through food passes through without being properly extracted. Research estimates that somewhere between 15 and 20% of adults over 60 have insufficient B12 levels, not because they're not eating enough of it, but because the machinery for absorbing it has lost efficiency. And the consequences of a sustained B12 deficiency are not trivial. They include a form of anemia that produces deep, pervasive fatigue and weakness. But they extend significantly further than that. B12 is essential for maintaining the myelin sheath, the protective insulating layer that surrounds nerve fibers throughout the body. When myelin is compromised, the neurological effects include tingling or numbness in the hands and feet, impaired balance, cognitive slowing, and memory difficulties that can be mistaken for the early stages of dementia. The important distinction with supplemental B12 is that it does not rely on the same absorption pathway as food-bound B12. Supplemental forms, particularly methylcobalamin, which is the biologically active version the body can use directly, are absorbed through a separate mechanism that bypasses the stomach acid requirement. A daily supplement of around 1,000 micrograms in this form is well tolerated and provides the nervous system and brain with the reliable fuel they need to continue functioning at their best. The second essential supplement is vitamin D3. This one sits at the center of a remarkably broad range of biological functions, and the shortfall in this age group is documented extensively in clinical research. 2 things happen simultaneously as we age that reduce the body's capacity to produce vitamin D. The skin becomes less efficient at synthesizing it from sun exposure, and lifestyle patterns tend to mean less time outdoors overall. The result is that a substantial portion of older adults are operating with vitamin D levels well below the threshold associated with optimal health. Most people know that vitamin D's primary role involves calcium absorption. That is accurate and important. Without sufficient vitamin D, calcium consumed through food or supplements is largely unable to cross from the digestive tract into the bloodstream and from there into bone tissue. Vitamin D acts as the gatekeeper, and without it, the gateway does not open properly. Bone density suffers as a result, and the risk of osteoporosis and fracture increases accordingly. But the scope of vitamin D's role extends considerably beyond skeletal health. Receptors for vitamin D exist in virtually every tissue in the human body. It participates in immune regulation, helping the body mount appropriate responses to infection while avoiding the kind of excessive inflammatory activity that contributes to chronic disease. It plays a role in muscle function, And here is something many people do not realize. Inadequate vitamin D contributes directly to muscle weakness and to the increased risk of falls. Not just through weaker bones, but through reduced muscular coordination and strength. Vitamin D3, known chemically as cholecalciferol, is the form the body produces naturally through sun exposure and the form that most effectively raises blood levels. General guidance often suggests between 1,000 and 2,000 international units per day for adults in this age range. But the most accurate approach is to have your actual blood level measured and work with your physician to identify the dose that brings you to an optimal range. That personalized approach consistently outperforms any general recommendation. This naturally connects to the third essential supplement, because vitamin D and calcium are biologically inseparable when it comes to bone health. Calcium is the primary mineral component of bone tissue, and the daily requirement for adults over 60 is generally around 1,200 milligrams from all sources combined. The key phrase is from all sources combined. Food should always be the primary source. Dairy products, leafy greens, almonds, fortified plant milks, canned fish with bones. Supplementation is meant to bridge whatever gap exists between what your diet reliably provides and what your body actually needs. The mistake that has caused some people genuine harm is treating calcium supplementation as something to layer on top of an already calcium-rich diet. When calcium intake is consistently excessive, particularly when vitamin D and magnesium levels are insufficient, there is legitimate concern that calcium may be deposited in arterial walls rather than in bone. That concern is real and worth taking seriously. The solution is not to avoid calcium, but to approach it intelligently. Track your dietary intake honestly for a few days. If you're consistently falling short of your daily target, supplement to close that gap, not to exceed it. Divide any supplement dose across the day rather than taking all at once, since the body absorbs smaller amounts more effectively. And take it consistently alongside vitamin D. These two work as a partnership and are substantially less effective in isolation from one another. The fourth essential supplement is magnesium, and it is genuinely one of the most underappreciated nutrients in the context of aging. Magnesium is involved in over 300 distinct biochemical processes in the body. It supports nerve transmission and muscle contraction, regulates heart rhythm, participates in blood pressure management, helps control blood glucose, contributes to the structural integrity of bone, and plays a central role in energy production at the cellular level. Perhaps most significantly for our purposes, magnesium is required to convert vitamin D into its biologically active form. Without adequate magnesium, vitamin D supplementation cannot do its job effectively, no matter how much you take. Magnesium also works alongside calcium to maintain the balance between muscular contraction and relaxation, which is why deficiency frequently manifests as the kind of nocturnal leg cramps that interrupt sleep and leave people feeling unrest in the morning. Deficiency is considerably more common in this age group than most people realize. The foods richest in magnesium, dark leafy greens, legumes, seeds, whole grains, and dark chocolate are not always well represented in the typical diet of older adults. Additionally, a number of commonly prescribed medications, including certain blood pressure drugs, diuretics, and proton pump inhibitors, can deplete magnesium levels over time. When it comes to supplementation, the form of magnesium matters significantly. Some forms, like magnesium oxide, are poorly absorbed and can cause digestive discomfort. Better absorbed and gentler alternatives include magnesium glycinate, which is particularly well suited for people who want the added benefit of improved sleep and relaxation, magnesium citrate, which is widely available and generally well tolerated, and magnesium malate, which some people find beneficial for energy and muscle comfort. A daily intake of 200 to 400 milligrams from a well-absorbed form is a reasonable starting point for most adults in this age group. Always in conversation with a physician who knows your full health picture. Taken together, these four nutrients, B12 for nerve and cognitive function, D3 for bones, muscles, and immune health, calcium at the right level for skeletal integrity, and magnesium as the conductor that ties the whole system together, form a genuinely evidence-based foundation for health in this chapter of life. They're not glamorous. They're not the supplements with the most compelling label copy, but they're the ones supported by decades of rigorous research and the ones most likely to produce real, measurable improvements in how you feel and function day to day. In removing the other four from an unsupervised daily routine, the iron that can silently accumulate to harmful levels, the high-dose preformed vitamin A that can erode bone density, the megadose vitamin E associated with real cardiovascular risk, and the vitamin K that can dangerously interfere with critical medications is equally important. What you stop taking can matter just as much as what you start. One thing I want to leave you with, above everything else I have shared today, is this. No educational resource, regardless of how carefully researched, can substitute for a conversation with a physician who knows your personal medical history, your current medications, your recent lab results, and your individual health goals. The information shared here is designed to make you a more informed participant in that conversation, to give you better questions to ask, to help you evaluate what you are currently taking with clearer eyes. It is not a prescription, and it is not a substitute for professional guidance. Your health in your 60s and beyond is not primarily a matter of luck or genetics. It is the cumulative result of the decisions you make consistently, what you put into your body, what you remove, and how carefully you engage with the medical guidance available to you. You are not at the mercy of aging. You are actively shaping how it unfolds. And that begins with knowing exactly what you are taking, why you're taking it, and whether the evidence genuinely supports it.